Most of us picture sleep as this quiet, passive reset button between one day and the next. But after years in the operating room, I can tell you the truth. While you're sleeping, your heart and brain are running a high-stakes overnight shift that never stops. Hi, I'm Dr. Richard Miller. I'm not here to scare you. I'm here to give you simple, powerful ways to protect yourself starting tonight. We now know the early morning hours, right before you wake up, are when your blood pressure naturally spikes and your heart works hardest. If your sleeping position is working against you, if your airway is even slightly restricted, or if your body is fighting gravity all night, you could be quietly stacking the odds against yourself. The good news, these are things you can actually change. Today, I'm going to walk you through exactly what's happening inside your body while you sleep and share the practical adjustments that can dramatically improve how you feel when you open your eyes tomorrow. Before we dive in, let me ask you something real. Do you often wake up with a headache, feeling groggy, or with numbness in your arms and shoulders? If that sounds familiar, drop the word rest in the comments below. I read every single one I can, and it helps me bring you information that actually matters to you. Let's start by changing how we think about sleep. While you're dreaming, your heart is busy delivering blood to your brain, your lungs are working to keep oxygen steady, and your spine is carrying the full weight of your nervous system. If your neck is twisted at a bad angle or your diaphragm is cramped, your body isn't resting, it's fighting. I remember a patient named Raymond, a sharp 6-year-old, who had slept on his stomach his whole life because it felt comfortable. His wife kept hearing these sudden gasping sounds at night. When we ran a sleep study, the results were eye-opening. His stomach sleeping habit was forcing his neck into a strained rotation that was making his airway collapse over and over. Every time his oxygen dropped, his heart had to race to compensate. It was exhausting him from the inside. When I asked him to try a different position, he laughed and said, "Doc, I've been doing this for 70 years. But we worked on it together, and within a few weeks, his blood pressure numbers improved more than either of us expected." So let me ask you, do you sleep on your stomach? If you do, let me know in the comments. It's more common than you think, and it often hides breathing problems we can fix. Now, a lot of people have heard that back sleeping is the best position. For some, it is. But for many of my older patients, especially those who snore or have sleep apnea, lying flat on the back can actually be the worst choice. Here's why. Gravity pulls your tongue and throat tissues backward, narrowing the airway. Your oxygen levels drop, your brain panics, and it triggers a surge of stress hormones. Blood pressure stays high instead of dipping down like it should during deep sleep. Over time, that constant pressure damages your vessels and raises your stroke risk. I know this can sound heavy, but there's real hope here. In our cardiac circles, we rely on 3 practical approaches that make a genuine difference. If you're learning something useful right now, type the word heart in the comments. It tells me you're with me and helps this message reach more people who need it. The first approach is left side sleeping with proper alignment. Research shows this position is often kinder to your heart and helps reduce acid reflux that can irritate your nervous system. The key is support. Simply rolling onto your side usually twists your hips and spine. Place a firm pillow between your knees to keep your pelvis neutral and your back happy. One of my patients, Caroline, had suffered from morning headaches for years. After she started using a knee pillow to stay comfortably on her left side, those headaches largely disappeared within 2 weeks. The second strategy is elevation. If you wake up with a heavy chest or you've been told you have sleep apnea, raising your upper body about 30 to 45 degrees can be life-changing. You don't need an expensive bed. A good wedge pillow or even stacked firm pillows works beautifully. This simple lift keeps gravity from collapsing your airway so your oxygen stays steadier and your heart doesn't have to work overtime. The third approach is what I call the recovery posture. It combines the first two. You sleep on your left side with a pillow between your knees while also using a wedge to keep your head and shoulders gently elevated. It might feel different the first few nights, but your body adapts quickly. Most people tell me they never want to go back to lying flat. These positions are powerful, but they're not a replacement for proper medical care. If you have high blood pressure or suspect sleep apnea, please talk to your doctor about a 24-hour blood pressure monitor. It can reveal if you have that dangerous non-dipping pattern we talked about. Beyond position, a few evening habits make a big difference. Cut back on salty foods at least 4 hours before bed. Salt makes your body hold fluid, which increases blood volume and forces your heart to work harder while you sleep. Also, ease up on heavy fluids about 2 hours before lights out. It reduces nighttime bathroom trips that break up your rest. And here's one of my favorite tips. Keep your bedroom cool around 65 to 68 degrees. A cooler room helps your body naturally shift into deep recovery mode and prevents those stress surges that wake you up. Finally, take just 5 minutes before closing your eyes to breathe slowly through your nose. Let your belly rise on the inhale and exhale gently. This simple practice calms your nervous system and tells your heart it's safe to rest. We're all getting older. That's part of life. But there's a world of difference between the changes that come with time and the damage we accidentally create through habits we can change. You have more power than you realize to protect your heart and your brain one peaceful night at a time. So tell me in the comments, which position are you going to try tonight? Are you already a side sleeper, or are you ready to try the elevation approach? I read your stories and I love hearing how these small shifts improve your mornings and your energy. If this video helped you, please subscribe and hit the notification bell. Next week, we're diving deep into the exact foods that research shows can help clear arterial plaque. You won't want to miss it. Thank you for spending this time with me. Take good care of your heart tonight, and I'll see you in the next video.